Go. Hi, my name is Lori Francis, and I have an informative speech for Navarro College, and my speech is about pancreatic cancer in 2019. How many of you here have known someone who has had cancer? Now, how would you feel if that person that you knew or yourself was diagnosed with pancreatic cancer, where 56,000 people will be diagnosed in 2019 and over 46,000 will pass away from it? I know how that feels. In May 16th of 2017, my husband was diagnosed with pancreatic cancer. I'm credible on this because I vowed when he was diagnosed to study and research as much about pancreatic cancer as I could. My informative speech is here for my audience to talk about pancreatic cancer symptoms, treatments, and survival rate. As you can see from my visual aid, here are some of the symptoms of pancreatic cancer. One is jaundice. It is due to the bile duct, the bile duct being blocked and the bilirubin levels are high. Jaundice usually has yellowing of eyes, yellowing of skin. Another symptom is abdominal or mid-back pain, which sometimes they consider like pain like nerve damage, sciatic nerve damage. Another symptom is excessive weight loss. That is due to a key enzyme in the pancreas that helps digest food that is reduced. Another symptom is itchy skin that is also from the bile duct being blocked and the excessive bilirubin. Now, on to the three main treatments of pancreatic cancer. As you can see from this visual aid, there is surgery, radiation therapy, and chemotherapy. Surgery, only 20% of the patients that are diagnosed with pancreatic cancer are able to have the surgery. The Whipple, is what the surgery is called, is to remove the head of the pancreas, the bile duct, part of the stomach, and part of the small intestines. In some cases, the tail, the gallbladder, and the spleen is removed. It takes several weeks to several months to recover from this major surgery. And that is cited from the pancreatic.net. Next is chemotherapy. It consists of a number of cycles giving over a period of 6 months with 2 weeks on, 1 week off, usually one treatment per week. Some of the drugs used in chemotherapy are Xeloda, which is a pill form. Then we have Gemzar, Abraxane, 5-FU, and Oxyvol, which are all IVs given at 4 to 6 hour sessions through IVs. That is the first line of treatment for pancreatic cancer. The second line of treatment usually involves several combined drugs. Radiation is another treatment. High energy x-rays are used to kill cancer cells that are left over from the chemo and or from your surgery. You can give it in large doses over 5 to 6 weeks, you can give it in small doses over 5 to 6 weeks, large doses up to 5 days. Radiation is used to decrease the likelihood of the cancer reoccurring. Now, we're on to our survival rate. As you can see here, the survival rate is only 9% for 5 years. Pancreatic cancer has about a 20% survival rate for the first year and only 9% for 5 years. Without the Whipple, you're only given a 7% chance for 1 year. With the Whipple surgery, you are given 23 to 36 months. The Whipple is named for Dr. Alan Whipple, who performed this surgery in the 1930s to remove the tumor from the pancreas. That is from the Hirschberg Foundation. The rate with chemotherapy is only 6 to 12 months, but can be extended with the surgery and with radiation. Radiation therapy alone is not anything, it's not a cure, it only prolongs life. And it's only used to kill, like I said, the cancer cells after surgery and or chemotherapy. Okay, in conclusion, pancreatic cancer is a silent but deadly disease. There is no known cure, only treatment to prolong life. Most symptoms from pancreatic cancer only occur in the later stages of the cancer. As a spouse of a pancreatic patient, unfortunately, your time is limited and is very unpredictable. My husband succumbed to his cancer November 13th, 2018. After an 18-month battle with cancer, he had the surgery. He had 30 rounds of chemo. So, in my conclusion, God's time, we're all on God's time. We need to love, live, and laugh as if it was our last day. My informative speech was about pancreatic cancer to let you know about the symptoms, treatment, and survival rate. Thank you.
Yeah.